which offers multiple tools like Hunt GPT, Insta PPT, and radiology assist, and so on, which is used by more than 60,000 doctors across specialties like orthopedics, gynecology, consultant physicians, and general surgeons. In fact, it gives me a great pleasure in sharing very important information that these value-added tools have achieved some soaring success over the last few months. 185,000 plus Hunt GPT prompts have been used by the doctors across the country to basically search and find out certain very important aspects in their practice. 65,000 plus PowerPoint presentations have been created by the doctors for their usage, either in seminars or any other sessions that they would want to do it. More than 15,000 scans have been done using the radiology assist by the doctor for the third opinion. This goes to show how WeConnect has been used by all of you across the country. And I'm sure my team would have come to you, and I'm sure many of you must be using these value-added tools. And I would be very glad if you give your feedback to my team, who will be visiting to you almost very regularly. We are also the market leaders in the respective categories. And all these leader brands can be seen here in the standees that is displayed. And I'm sure most of these brands must be used by you as well. With our core values of innovate, impact, and inspire, backed up with a very clear purpose of being the preferred scientific partner of choice for the doctors, we are committed to address the unmet clinical needs for the clinicians across the country through our unique scientific initiatives.
I am Dr. Shobhit Seth, Chief of Medical Services to the Degree Center. First of all, I would like to thank and welcome Speaker Sir and all the delegates who have gathered here to attend this summit. In the past 5 years, we have embarked on a journey to be the knowledge partner of choice from the specialty of doctors. We created blueprints like best of orthopedic techniques. We created Origin. This is an oasis of recognized and innovative practices in gynecology. We created the Connect series, where we spoke about OsteoConnect, dealing with the problems of osteoporosis. Then we created MTP Connect and Pad Connect, which was focused for the physicians. We have also created many certification courses, like all about gestation course. And recently, we launched a CDI, that is Jalandhar Diabetes Institutions certification course for the physicians, the general surgeons, and for the gynecologists. Gynecologists, well, they enhance their skills, their learning on gestation diabetes management, for the general surgeons, and for the physicians. We created a podiatry course, that is treatment and management of diabetic foot infections. And of course, what are the recent trends, what are the recent drugs used in better diabetes care. But there are many things in the offense. We are soon going to come 6 series. And for Origin, again, we are launching a program which will be dedicated to the gynecologist. Now, I don't want to review further. There are many programs scheduled for the general surgeons and for other specialty doctors. So now, where are you supposed to log in? You have to join the WeConnect. You have to download the WeConnect app, and there you will get a treasure chest. It is a treasure chest full of AI tools which will help you enhance your practice. Now, this WeConnect app is the third opinion app for you. It gives you, validates your opinion of your colleague, and it gives you an AI-based opinion. So check it, check all the tools which are there, which are powered by artificial intelligence. So more on that, my team member who's there with you, he will guide you and take you through. So I wish you a happy learning is this roundtable meeting, an excellent experience. Do give us your feedback how we can improve. So have a great day and a happy learning session. Thank you.
हाँ प्रेजेंट कर
ये That can be the vaginal tablets, that can be the ointment, that can be the oral tablet, and the different things. But in the complicated or the recurrent infection, you have to give the combined therapy. The single tablet is not going to take care. In the complicated cases, you have to give the combined oral tablet as well as the vaginal tablet also. So how will you differentiate if this patient is having candida infection or they have the bacterial vaginosis? These three vaginal infections are very common in ladies. So you see the differences. One, the clinical history, then by the discharge characteristics, and by the signs patient what they have, and the vaginal pH. So I am telling you the differences. Now in the discharge characteristics, if the candida infection, what happens? There is always, Dr. Silvery, please aja, please aja, you welcome. He is Dr. Silvery. Please have a seat. लाइक कि मैंने थोड़ा सा स्टार्टिंग में बताया था, इफ यू वांट टू सी तो मैं रिपीट कर दूं, अदरवाइज नेक्स्ट में कवर हो जाएगा, इट्स ओके. सो आई एम टेलिंग यू अबाउट द vulvovaginal infections. So vulvovaginal infection is very common. The candida infection is very common in the ladies. You know the fungal infection. So if you see the percentage is very high, you see the 70-75% of the patient they do get this fungal infection. So how you diagnose? You can diagnose by the different characteristics because there are three infections are common in ladies. One is candida, that is fungal. Second is trichomonal. Third is bacterial vaginosis. So how can you differentiate between three? So I am going to tell you this. This is important. In the discharge characteristics in candida, always the white discharge is thick, curdy, and white. So you can examine and you can differentiate which this patient is probably have the fungal infection. In the trichomonas infection, there is a profuse yellowish discharge and the burning in the urine. Now, third one is the bacterial vaginosis, which is common in pregnancy as well as it is very common in the menopausal and postmenopausal ladies because of difference of pH. So, but here in discharge. Now, next characteristic is about the odor. In candida, not much of obviously odor, but the trichomonas there is definitely fungal. And the second में trichomonas में there is also itching, but not in the bacterial vaginosis. Now, fourth is the other symptoms. If you see, examine the patient, you see in the candida there is a soreness, जख्म हुए हैं, redness हुई है, डिस्पार्नेशंस में उनको पेनफुल होगा, एंड उनके बल्बा और उनके बर्निंग होगा यूरिन में, नीचे उसके इरोजन होगा, एंड देन लोअर और इवन इन द ट्राइकोमोनस यू गेट सिम्टम्स. यूरिन में प्रॉब्लम हो सकती है, थोड़ा लोअर एब्डोमिनल पेन हो सकता है, बट नॉट इन द बैक्टीरियल वेजिनोसिस. नाउ नेक्स्ट इज द साइंस. Sign is when you examine the patient, what do you get? You see there is a vulva में उसके external part में redness बहुत होगी, erythemas होंगे, and there is edema, swelling होगी, ठीक है ना, फिशरिंग होगी, satellite lesions होंगे, और ट्रैकोमोनस में उनको भी रेडनेस होगी, और उसकी जो सर्विक्स है, ये तुम एग्जामिन स्पेक्युलम में देखोगे, यू सी टिपिकली द स्ट्रॉबेरी सर्विक्स, जैसे सर्विक्स है उसमें बीच बीच में स्ट्रॉबेरी में स्पॉट्स होते हैं, इस टाइप के रेड रीजन्स होंगे, यू कैन मेक आउट. एंड इन द बैक्टीरियल वेजिनोसिस यू सी देयर इज लिटिल बिट ऑफ inflammation and little discharge. So this is a milder variety you can take. And after examination, if you see the pH में क्या होता है? In the candida, pH is normally maintained, but in both the conditions, the pH is more. pH is more. Next, laboratory, हाँ. If you do the macroscopy of this thing, you see, you can do the saline preparation. Saline is जैसे normal saline है, नमक के पानी में डाल के आपने एक ड्रॉप में डाल के उसको माइक्रोस्कोप में देख लिया, ये जिसमें फंगल. नंबर 2, ये जिसका ग्रैंड स्टैनिंग किया तो तुमको बाकी दूसरा ट्रैकोमोनस का पता चल जाएगा, और यदि बडिंग दिख रही है तो फंगल इंफेक्शन है. नेक्स्ट, एक होता है, हम बड़े कॉमनली करते हैं, हम लोग पेप स्मीयर करते हैं लेडीज का. वी राइट स्टार्ट फ्रॉम द 35 years of एज, 35 years of एज से शुरू कर देते, पेप्समियर में क्या करते हैं, सर्विस से डिस्चार्ज लेते हैं, पेशेंट का कैंसर का डिटेक्शन करते हैं। तो पेप्समियर का इसमें बहुत ज्यादा रोल नहीं है, उसमें इंफेक्शन हुआ तो बहुत ज्यादा पेप्समियर में आपको ज्यादा फाइंडिंग नहीं मिलेंगी। ठीक, उसके आगे और एडवांस टेस्ट बहुत, यदि पेशेंट नहीं ठीक हो रहा, कुछ हो रहा, देन यू विल हैव टू डू द पीसीआर करोगे डिस्चार्ज का। आजकल नेट टेस्ट आया है ना, न्यूक्लियस एसिड एम्प्लीफिकेशन, उससे और क्लियरली पता चल जाएगा कि कौन सा ऑर्गेनिज्म अफेक्टेड है, यू कैन मेक आउट वेरी वेल। ठीक है, अच्छा नेक्स्ट आ जाओ, नेक्स्ट बेटा। हाँ, अब ट्रीटमेंट ऑफ बल्बो वजाइनल कैंडिडाइसिस कैसे करेंगे? ठीक है, इसमें क्या है कि अपने आप कई बार ट्रीट नहीं होता, रिकर होगा बार बार। So however, it is not advisable as a clinical diagnosis may not be accurate in the majority of the cases. So treatment is dependent upon कि तुम्हारा जो candida infection है, is it complicated or uncomplicated? If it is complicated, then patient may be having pregnancy, diabetes or HIV infection होता है, that is a complicated infection. Complicated infection is mostly going to recur, उसने बार बार होना है। ठीक है, व्हाट इज रिकरेंट वेजिनाइटिस, जिसको 3 टाइम्स, मोर देन 3 टाइम्स पर ईयर हो जाता है रिपीटेडली, सो दैट वी कंसिडर कि शी हैज अ रिकरेंट वल्वोवैजाइनल इंफेक्शंस, सो दैट पेशेंट नीड मोर एग्रेसिव ट्रीटमेंट। पेशेंट बोलता है मैंने डॉक्टर साहब दवाई ली थी, ठीक हो गया है, उसके बाद में फिर मेरे को महीने के बाद सेम प्रॉब्लम हो गई, फिर महीने के बाद फिर सेम प्रॉब्लम हो गई। सो दिस इज a recurrent infection is very common. And what is the uncomplicated and what is the complicated? In uncomplicated cases, कभी कभी उसको होगा recurrent में, as I told you कि more than 3 times per year they get the infection, and mild to moderate और इसमें in uncomplicated mild और moderate होगा, but in complicated they get the severe symptom, बहुत severe symptom होंगे, and likely to be candida albicans। और इसमें क्या होगा, यदि कॉम्प्लिकेटेड है तो कैंडिडा के अलावा जो मैंने स्पीसीज 10% में बताई है, 10-20% में, सो दीज स्पीसीज आर मोर कॉमन इन दैट केसेस, इन कॉम्प्लिकेटेड केसेस। और जो अनकॉम्प्लिकेटेड होंगे उसमें तो पेशेंट कॉम्प्रोमाइज नहीं होगा, नॉन इम्यूनो, जिसकी इम्यूनिटी अच्छी है उसको ठीक हो जाएंगे। कॉम्प्लिकेटेड में द पेशेंट जिनकी इम्यूनिटी सिप्रेस है, या जो स्टेरॉइड बहुत ले रहे हैं, या इनकी प्रेगनेंसी है, या इसको डायबिटीज है, या इसको HIV है, उनको हो गया, तो दीज आर कॉम्प्लिकेटेड। अब ट्रीट कैसे करते हो? आप डायग्नोस भी कर लिया, पता आप कैसे उसको इलाज करोगे। तो इंट्रावजाइनल मोस्ट ऑफ द टाइम क्या करते हैं हम लोग, पेशेंट को वजाइनल ट्रीटमेंट लोकल देते हैं, चाहे ऑइंटमेंट होगी चाहे वजाइनल टैबलेट्स होगी। टैबलेट्स को बोलते हैं वजाइनल में पैसिरीज। सो इन द क्वाट्रामेजोल 1% cream you give vaginally, cream for at least 1 or 2 weeks, 1-2 weeks के, or you can give tablets suppository for 7 days, one daily at night for 1 week. Second option, you can give myconazole। myconazole जो होता है ये कैंडिडा इन्फेक्शन के लिए बहुत अच्छा होता है, इसमें भी आप उनको दे सकते हो, क्रीम दे सकते हो for 1 week, और you can give tablet vaginal for 1 week। थर्ड ऑप्शन हो जाता है द बेस्ट, मॉडर्न में सबसे बेस्ट ऑप्शन है, एक if it is a complicated case, you may not be corrected with just simple vaginal tablet, you have to take oral tablets also. So in that case, you have to take the itraconazole. Itraconazole you have to take 200 milligram twice a day, or for 1 day, or you can take the combinations. Combinations में you have to take the cotrimazole combination with prednisolone, that is steroid, or you give this ointments. These ointments are available. Next, complicated cases, they have naturally the severe symptom. उनके कैंडिडा जो होते हैं, that is they have non-candida infections, which is, as I told you earlier, that is in pregnancy, that is in uncontrolled diabetes, and in the immunity compromised patients, and they used to get the recurrent infections. Next, what is recurrent infections? As I told you, if it is defined as 3 or more or the 4 or more episodes of symptomatic vulvovaginal infection per year. And what is the pathology behind this? And they are mostly affected not by the Candida albicans but by the Candida variety, but the other varieties like Glaberetta and other non-albicans species in 10 to 20% of cases. And they need also antifungal therapy, but in the combined ways and for the longer time, longer duration. Next. What is the treatment of individual episode? If they give the individual episode, what we give, we first line of therapy for the simple uncomplicated infection, what we used to give first line is the fluconazole. Fluconazole 150 भी आती है, 100 भी आती है, 150. But in the vaginal infection, mostly we prefer 150. 150 you give, and you give first day, fourth day, and seventh day. One course. And after that, you give for 14 days and for maintenance therapy. So three is not enough. After that, you have to give the oral fluconazole. You have to give weekly. We used to give to the patient, you take every Sunday for 6 months, once in a week. And what second therapy is, you can also give that there is a local treatment, and but 30 to 40, 50% of the women may experience recurrence of infection after discontinuation. They say that once we stop the medicine, again the same thing recurs. So in that case, special consultation means you cannot give the general practitioner, they cannot give, they will send to the gynecologist proper for the specialist, and we give the Fenza and other medication for 14 days and for the longer duration. What are the special considerations? Suppose, as I told you, कि immunocompromised patient है तो उसको क्या extra चाहिए? So in that case, the treatment is the prolonged. You have to give minimum for 14 days therapy, and maintenance therapy also you will have to continue the maintenance therapy also for 6 months at least. It occurs in pregnancy. That is also a complicated case, and they used to get the recurrent infection. So in that case, why it is more common in pregnancy? Because the hormone level increases in the pregnancy. Estrogen and progesterone increases. So they are more prone to get the fungal infection. So, and there is more growth of candida and more colonization of candida. And it is more prevalent in the pregnant women compared to the non-pregnant women, because in pregnancy, along with Candida albicans, there are mixed infection of bacterial vaginosis and other mixed infections are also associated. So simple with that therapy, you patient cannot be cured. So the pregnancy outcome here is the colonization is by Candida and other infections. And what are the risks if the Candida infection you do not correct in the pregnancy? More chances of premature deliveries, and it is low birth weight babies. Next. Treatment guidelines in pregnancy, you have to give the azole, cotrimazole. Treatment you give the vaginal. Oral you should avoid. Oral you can give fenticonazole, Fenza in the second trimester onwards. Not in the first, second trimester you can give fenticonazole vaginal first day and third day, 600 milligram. It is very safe and effective. There is no harm, no side effect, nothing. If HIV patient, HIV depends on the severity of HIV. If the HIV is very severe, you have to give the strong medication for longer time. Same medication, you have to give oral tablet as well as local application, topical application ointment in this. Next one. In the uncomplicated cases, treatment should be similar in the seronegative. Complicated cases may you have to do long-term treatment weekly for 6 months at least, and HIV you have to give again for the longer period of time. What are the challenges in the if the it happens in the diabetes patient, because there is an increased sugar level, so always the fungus grows in the glucose, so more chances of infection. So unless and until you don't control the diabetes, the infection is not going to control, it is going to recur again and again. So along with that, you have to control the diabetes as well. treatment consideration is you have to give antifungal drugs, then diabetic complication prevention, one thing you have to very clearly if the patient is taking anti-diabetic treatment. In the drug interaction, what if you give the fluconazole or itraconazole? If patient is taking sulfonylurea, so the effect of sulfonylurea will be increased. So the patient taking same dose along with this treatment, so patient may get the hypoglycemia. So उसको बोलना पड़ेगा कि या तो शुगर कंट्रोल करो, उसको कंट्रोल करना. स्किन में भी फंगल इन्फेक्शन इज वेरी कॉमन, समटाइम इट हैपन. प्रोराइटिस हो गया तो उसके लिए भी आप स्टेरॉइड की ऑइंटमेंट लगाओ या एंटीफंगल ऑइंटमेंट लगाओ, दैट कैन बी करेक्टेड. अगला नेक्स्ट. स्किन में हो गया तो तुमको हो गया डायग्नोस्टिक सैटेलाइट पेप्यूल हो जाएंगे, दाने हो जाएंगे, इरोजन हो गए, इचिंग बहुत होगी. ठीक है. एंड यदि लोकल हुआ तो वल्वर एडिमा होगा जहां पे भी होगा. ठीक है. So this type of patients is common in the nutshell. If the patient comes to you, you have to diagnose by your clinical history, by the clinical discharge, and if the patient is complicated one, you should investigate. You just see the normal line. You can see in your OPD under the microscope. You can see hyphae. You just give the treatment. You have to give treatment for the longer time because the chances of recurrences are very common in fungal infection. And that's all. Thank you for your patient hearing. Okay. चलो अब आपको